All right, so you really threw us a curveball this time.
Well,
We're doing a deep dive into WINREVAIR,
right.
and we've got pages and pages of prescribing information here about this brand new drug
Brand new.
for pulmonary arterial hypertension.
PAH.
No, PAH.
Yeah.
That serious condition where
Sir,
the blood vessels in your lungs get all tightened up,
get on.
making it really tough for your heart to do its job.
For the heart to pump blood through
Yeah.
effectively.
So let's roll up our sleeves and figure out what this WINREVAIR is all about
Let's do it.
and what you really need to know.
Yeah, the first thing to understand is that WINREVAIR isn't your typical blood pressure medication.
Oh, really?
Yeah, it's actually something called an activin signaling inhibitor.
Okay. Yeah, that sounds
It's a little bit complicated.
Yeah, a little bit. What's this activin thing all about?
So think of activin,
Okay.
like a little messenger
Right.
in your body,
Okay.
telling cells to grow and blood vessels to form.
Okay.
But in PAH,
Right.
those messages get kind of scrambled,
Oh, so they're not.
leading to a buildup of cells in the walls of your lung arteries.
They're not getting the right messages.
Exactly.
Interesting.
They get thicker,
Uh-huh.
stiffer,
And then
and blood flow gets restricted.
yeah, that makes sense.
WINREVAIR steps in to block those scrambled messages,
Oh, okay.
calming things down,
Oh, okay.
and hopefully improving those blood vessels' function.
So it's not about lowering blood pressure directly, but more about tackling the root of the problem in the blood vessels themselves.
You got it.
Okay, that makes sense.
That's why it's specifically approved for adults with PAH.
Mm,
The goal is to improve their ability to be active,
okay.
how well they can manage daily tasks,
Mm-hmm.
and ultimately to slow down the progression of the disease.
No, it's not a cure,
Not a cure.
but it helps.
It helps to manage and hopefully slow it down.
Yeah, that makes sense.
Yeah.
So how does this WINREVAIR actually get into your system?
Oh, good question.
What's the deal with taking it?
It's a subcutaneous injection,
Okay.
which means you get it just under the skin,
Okay.
kind of like how some people take insulin.
Yeah.
And you only need it every 3 weeks.
Oh, wow, that's not bad.
The dosage is tailored to your weight.
Okay.
You start with a lower amount,
Hmm.
and your doctor might adjust it over time,
Makes sense.
aiming for the right dose for you.
Okay, so that's not too bad.
Not too bad at all.
An injection every 3 weeks.
Every 3 weeks.
But I'm seeing here in the prescribing info that your hemoglobin and platelet levels can also influence the dosage.
That's a great question.
Why is that?
That's actually linked to some of the things we need to be cautious about
Oh,
with WINREVAIR.
okay.
Hemoglobin is what carries oxygen in your red blood cells.
Right.
And platelets are those tiny cells that help your blood clot.
Yeah.
This medication can affect both of those.
So they keep a close eye on your blood work to
Exactly.
make sure everything's in check. That seems pretty standard for a powerful drug.
Yeah.
Are there any absolute reasons why someone shouldn't take WINREVAIR? Like any hard no's?
That's interesting. The prescribing information doesn't list any absolute contraindications,
Oh, so no hard
meaning there are no hard and fast rules against taking it.
and fast rules. However,
There was a but coming.
this is where it gets important.
Betsy, lay it on me.
There are definitely some serious warnings and precautions that need careful consideration.
All right, what are these big concerns?
One of the things they watch for is something called erythrocytosis.
Erythrocytosis.
It basically means you end up with too many red blood cells.
Oh, okay, so too many red blood cells.
Yeah.
Why is that a problem?
Imagine your blood getting a bit thicker than usual,
Okay.
making it harder to move through your blood vessels.
So it's like it's too thick to go through.
Yeah, and this can increase the risk of blood clots.
Oh.
And in some severe cases, it can even lead to something called hyperviscosity syndrome.
Hyperviscosity. It's almost like your blood gets too thick to flow properly,
Oh, wow.
which can cause real problems.
That doesn't sound good.
Yeah, it's not good.
So they monitor your hemoglobin levels closely
Very closely.
to make sure things don't get out of hand.
Exactly. And there's another issue they watch for,
Okay.
thrombocytopenia,
Thrombocytopenia.
which is the opposite problem.
Okay.
It means you have a lower than normal platelet count.
And since platelets help our blood clot,
Exactly.
I'm guessing this means there's a higher risk of bleeding.
You got it.
Okay.
Someone taking WINREVAIR might bruise more easily,
Oh, yeah, that makes sense.
have nosebleeds,
Uh-huh.
or even experience internal bleeding in more serious situations.
So I'm guessing it's extra important to tell your doctor about every single medication you're taking.
Absolutely.
Prescriptions,
Prescriptions.
over-the-counter stuff,
Everything.
even vitamins and supplements, just
Yeah.
in case something interacts badly with WINREVAIR.
You got to be completely upfront about all medications.
Yeah.
It's crucial, especially with a new drug like this.
Especially a new drug.
And this is actually highlighted in the prescribing information.
Oh, really?
because they found that thrombocytopenia,
The low platelet.
the low platelet issue,
Yeah.
was more common in folks who are also on a prostacyclin infusion,
Oh, so that's
another type of medication often used for PAH.
another medication on top of this one.
Yeah,
Okay, this is starting to feel a bit heavy.
yeah.
I'm seeing here that serious bleeding was actually reported in the clinical trials for WINREVAIR.
You're right, it's serious stuff.
Yeah.
And again, those taking prostacyclins or antithrombotics,
Okay.
medications that affect blood clotting,
Right.
we're more likely to experience bleeding issues.
Oh, wow.
The takeaway here is that if you're taking WINREVAIR and experience any significant bleeding,
Yep.
you stop the medication
Mm.
and contact your doctor immediately.
No messing around with that.
Absolutely not.
Okay, on to another big one.
Big one.
Pregnancy and fertility.
Very important.
Are those concerns with this medication?
They are.
Okay.
The prescribing information is very clear.
Right?
WINREVAIR can be harmful to a developing fetus.
Okay.
It's a big deal.
Mm.
And it also states that it may impair both male and female fertility.
Wow. That's a lot to process.
It is.
It seems like there's a lot to think about with this medication.
A lot to think about.
Even before we get into whether it actually works.
Yeah, you're absolutely right.
Yeah.
We've covered some intense stuff about potential risks with WINREVAIR.
Yeah.
But to be fair, most medications come with some side effects.
Right.
So let's talk about the more common ones people experience.
Yeah.
A little bit lighter, maybe.
Yeah. Let's lighten the mood a bit. What
Yeah.
are we talking about here?
The most frequently reported ones were headaches,
Okay.
nosebleeds,
Mm-hmm.
rashes,
Okay.
and something called telangiectasia.
Telangiectasia.
I know it's a big word.
Yeah, what in the world is that?
Don't worry, it's not as scary as it sounds.
Okay.
It's basically just spider veins.
Oh.
Yeah. Other common side effects included diarrhea,
Okay.
dizziness,
Uh-huh.
and erythema,
Erythema.
which is just redness of the skin.
Okay.
Just redness.
So nothing too out of the ordinary
Yeah,
side effects you might see with lots of different medications.
exactly.
Yeah.
And the information notes that these were generally mild.
Okay. Yeah.
Still worth noting, of course. And anything that concerns you should be discussed with your doctor.
Of course.
It's also interesting that the telangiectasia,
The spider veins.
the spider veins,
Yeah.
didn't usually show up until later in the treatment, often after around 47 weeks.
Oh, wow. So way later.
Yeah, it was interesting.
That is interesting.
Yeah.
Okay, before we wrap up this part of our deep dive,
Yeah.
were there any other intriguing nuggets in this prescribing information that jumped out at you?
A couple of things.
Okay.
First, they noted increases in blood pressure
Oh, okay.
in people taking WINREVAIR.
So that's something to keep in mind.
Obviously something to keep an eye on, especially if you already have blood pressure issues.
Yeah, that makes sense. It's easy to get tunnel vision on the really scary potential problems.
Exactly.
And forget about the more everyday issues.
Yeah, the everyday stuff is important too.
Yeah.
And the other thing was that there isn't a lot of data
Oh,
on the use of WINREVAIR in folks over 75 years old.
interesting. Why is that important?
As we get older,
Right.
our bodies often process medications differently.
Yeah, that's true.
We can be more susceptible to certain side effects.
Makes sense.
So not having much data on this age group means doctors need to be extra cautious
Yeah, for sure.
when prescribing WINREVAIR to older patients.
Okay, I'm starting to see why you said this would be a challenging deep dive.
Yeah, it is
We've covered a lot of ground here,
a lot of ground.
but there's still so much more to understand.
So much more.
We need to look at the clinical trials
Yes,
to figure out if this drug actually works
exactly.
and really get a handle on the whole benefit versus risk picture.
That's the next step.
Okay.
The prescribing information lays the groundwork,
It lays the groundwork.
but those clinical trials are where we see how WINREVAIR performs in real life.
Okay, so buckle up, listener.
I'll boggle up.
We'll be digging into the nitty-gritty details of those clinical trials when we come back
In part 2.
in part 2 of our deep dive into WINREVAIR.
Yes. Welcome back to our deep dive on WINREVAIR.
Yeah, so last time we were talking about
All those risks.
all the
The
risks,
side effects.
the potential downsides
Yeah.
of this medication.
Now it's time to see if it actually works.
Yeah, does it actually live up to the hype?
Does it deliver?
Let's find out.
The most important trial to look at is called STELLAR.
Okay, stellar.
It's a phase 3 clinical trial.
Phase 3, so that's
In the world of drug development,
the big leagues.
that means it's the big leagues.
Okay.
A large-scale, rigorous study designed to get a really clear picture of how effective and safe a drug is.
Okay, so walk me through it.
Okay.
What did they actually do in the stellar trial? And what were the results?
They enrolled over 300 adults with PAH
Okay.
and randomly assigned them to one of two groups.
So like a
One group received WINREVAIR,
control group
and the other received a placebo.
and a placebo group.
Now, here's a crucial detail.
Okay.
Both groups continue taking their existing PAH medications, what we call background therapy.
So they weren't starting from scratch.
They were not.
With medication, why is that important?
It helps isolate the specific effects of WINREVAIR.
Oh,
By keeping everyone on their existing regimen, they can be more confident that any differences they see between the groups
yeah.
are due to WINREVAIR, not just variations in other treatments.
So it's like a controlled experiment.
Exactly.
Makes sense. So what were they measuring? How do you even tell if a drug is working for PAH?
One of the key measurements in PAH trials is the 6-minute walk distance,
6-minute walk distance.
or 6MWD.
Okay.
It's a simple but powerful test
Simple.
where you see how far someone can walk in 6 minutes.
In 6 minutes.
It gives you a good idea of their exercise capacity
Okay.
and overall functional ability.
Right, because even walking short distances can be incredibly difficult.
Incredibly difficult.
For people with PAH.
You got it.
Okay.
And what they found in Stellar
Uh,
was that on average, people taking WINREVAIR
okay.
could walk about 41 meters farther at week 24 compared to the placebo group.
41 meters, that sounds like a substantial difference.
It's clinically meaningful,
Okay.
and it tells us that WINREVAIR is having a real impact
A real impact.
on people's ability to be active.
So it's helping them.
It's helping them be more active.
Okay, but I know you can't judge drugs solely on how far someone can walk.
You're right. We need to look at the bigger picture.
What other outcomes were they looking at in the trial?
They also assessed something called WHO functional class,
WHO functional class.
which basically categorizes the severity of someone's PAH
Okay.
based on their symptoms and limitations.
Okay.
Think of it like a scale,
Okay, a scale.
with higher numbers indicating more severe PAH.
So like a 1 to 10 scale.
Kind of, yeah.
So are you saying that people taking WINREVAIR moved down the scale?
That's exactly it.
Meaning their PAH got less severe?
They improved.
Wow.
The Stellar trial found that a significantly higher percentage of people taking WINREVAIR
Okay.
improved by at least one functional class compared to those on the placebo.
That's encouraging. Not just being able to walk farther,
Yeah,
but actually feeling better in their everyday lives. That's what really matters.
that's what matters.
Okay.
But here's the million-dollar question.
Okay.
Does WINREVAIR actually help people live longer, or at least prevent their PAH from getting worse?
So this is the big question.
This is the big one. This is where things get really interesting.
Okay, I'm all ears. Tell me more.
In the Stellar trial,
Okay.
they kept track of something called clinical worsening events.
Clinical worsening events.
This encompasses a range of serious outcomes, including death, the need for a lung transplant hospitalization due to worsening PAH, or having to start new PAH medications, or increase the dose of existing ones.
Oh, wow. Okay.
So they found was pretty remarkable.
Yep.
People taking WINREVAIR had an 84% lower risk of experiencing one of these events compared to the placebo group.
84%. That's a huge reduction in risk.
That is huge.
Okay.
Now, it's important to remember that this doesn't guarantee that everyone on WINREVAIR will live longer,
Right.
but it strongly suggests that this drug can significantly delay the progression of the disease
Okay.
and lower the chances of those serious complications.
So the Stellar trial seems to paint a pretty optimistic picture of WINREVAIR's effectiveness.
It does.
But as we have already discussed, no drug is perfect.
No drug is perfect.
We have to acknowledge that there's always a balance.
Always a balance.
Between benefits and risks.
Benefits and risks.
Right.
We've talked about some of the potential side effects, and those need to be carefully considered, even in light of this impressive efficacy data. It's about weighing the pros and cons.
Right.
And having an open conversation with your doctor
Yeah.
to determine if WINREVAIR is the right choice for your individual situation.
Right, because everybody is different.
Everybody's different.
And that brings us back to the importance of those conversations.
Those conversations.
Between doctors and patients, making sure everyone is on the same page.
Same page.
And understands the potential benefits and risks.
It's all about shared decision-making.
Yeah.
The doctor brings their expertise, the patient brings their own understanding of their body and their values,
Right.
and together they can navigate the complexities of treatment options.
Okay, I think we've done a good job dissecting the science
Yeah.
behind WINREVAIR.
Yes.
We've talked about how it works, what the clinical trials show, and the potential downsides.
Yep.
But I think it's important to take a step back
Okay.
and think about the human side of all this.
The human side.
What does this all mean for the people actually living with PAH?
That's the crucial question, isn't it?
It is.
PAH is a serious life-limiting condition,
Yeah.
and any new treatment that offers hope is a big deal.
Yeah. Any glimmer of hope.
But it's not just about numbers and statistics.
No.
It's about people being able to breathe easier,
Right. Being able to function.
walk farther,
Yeah.
spend more time with loved ones,
Yeah.
and live fuller lives.
And just live better.
Exactly.
I imagine that for someone newly diagnosed with PAH,
Yeah,
this information about WINREVAIR could be incredibly empowering.
absolutely. It gives them options, it gives
Yeah.
them hope,
Yeah.
and it allows them to actively participate in decisions about their own care.
Yeah, for sure. While we were talking about the risks earlier,
Yeah.
I noticed in the prescribing information
Yeah.
that there seemed to be some differences in side effects between older and younger patients.
Interesting.
Can you tell us more about that?
That's an important observation. As we age, our bodies change.
Right.
And this includes how we process medications.
Yeah, of course.
We might become more susceptible to certain side effects.
That makes sense.
In the case of WINREVAIR, bleeding events seem to be more common in older patients.
Okay, so older patients, more bleeding events.
Makes sense considering we already talked about WINREVAIR's potential impact on platelet counts.
Right.
Older adults often have age-related changes in their blood clotting system.
Yeah.
So adding a medication like this to the mix
could really exacerbate that.
could increase their risk of bleeding.
Yeah, for sure. So age is a factor.
Age is a factor.
But I imagine there are other individual variations that could influence how someone responds to WINREVAIR.
Absolutely.
Genetics, lifestyle, other health conditions.
They're spot on.
There's a lot to consider.
We're all unique, and our bodies don't always react to medications in a predictable way.
Yeah, for sure.
That's why personalized medicine is becoming increasingly important.
Personalized medicine.
It's about tailoring treatment to the individual, considering all those factors you mentioned,
Yeah.
their genetics, their lifestyle, their medical history,
Right.
to maximize the benefits and minimize the risks.
So it's not one size fits all.
It's not one size fits all.
That brings us back to the importance of that doctor-patient relationship
Always important.
and having open, honest conversations about what's best for each individual.
It's a partnership. The doctor brings their expertise. The patient brings their own knowledge of their body and their values, and together they make informed decisions about the best course of treatment.
We've explored a lot about WINREVAIR, the science, the potential benefits and the risks. But there's one more crucial aspect of the prescribing information we haven't tackled yet,
Okay.
the patient counseling section.
Okay.
The counseling, this is where we shift gears from the technical details
The technical stuff.
to the practical advice people need to manage their care effectively.
Yeah, that's where the rubber meets the road.
Right.
It's great to understand the science behind a drug, but ultimately it's about how people can use that information to make decisions and take action.
Let's delve into those patient counseling points when we return for part 3 of this deep dive. Okay, so we're back
Back for part 3
for part 3
of our deep dive.
of our deep dive into WINREVAIR.
We made it.
We made it. We're here.
And this time we're talking about
This time,
patient counseling.
patient counseling.
That's right.
Yeah, this is where we move from the technical
Yeah,
details
that sciencey stuff.
to the practical, everyday stuff that can really make a difference
The real world.
for people
Yeah.
taking this medication.
Exactly.
What I find fascinating about this section
Mm.
is the emphasis on open communication and shared decision-making.
Shared decision-making
Yeah,
between doctors and patients.
between doctors and patients.
It's not just about following instructions.
Right.
It's about empowering patients
Yeah.
to be actively involved in their own care.
To really understand,
on.
it's about making sure everyone is on the same page
Yeah.
and understands the potential benefits
And risks.
and risks.
Right.
So what are some of the key points
Yeah, what are some of those key points?
that doctors are advised to discuss with their patients? Well, first and foremost,
First and foremost.
they need to make sure patients understand those potential risks we already talked about.
We talked about a lot of risks.
We talked about a lot: erythrocytosis,
Thrombocytopenia.
thrombocytopenia,
Serious bleeding.
serious bleeding.
It's not about scaring people,
No, of course not.
but about giving them the knowledge they need to make informed decisions.
Yeah.
And recognize any warning signs early on.
Be aware so they can
Exactly.
contact their doctor
Exactly.
if something comes up.
And I imagine that includes emphasizing the need
Yes.
for regular blood monitoring
Regular blood
to
monitoring.
check those hemoglobin and platelet levels.
Right. Got to check those levels.
Those tests are crucial, especially at the beginning of treatment.
At the beginning when you're first starting.
It helps ensure the dosage is correct
Okay.
and allows doctors to catch any potential problems before they become serious.
Great.
The information also stresses the importance of discussing
Discussing.
pregnancy and fertility.
Yeah, this seems like a really
This is a critical conversation,
critical conversation.
especially for women of childbearing age. The potential risks to a developing fetus are significant,
Right.
and the prescribing information makes it clear
Very clear.
that effective contraception is essential while taking WINREVAIR
While taking it.
and for a period of time after stopping treatment.
Right, so it's not just while you're actively taking
It's
it.
after as well.
There's a period of time afterwards where those risks
The risks are still there.
can still be there.
Yeah, and it's not just about preventing pregnancy.
You're right.
It's also about the potential impact on future fertility.
The future fertility.
These are sensitive topics, but they need to be addressed openly and honestly.
Openly and honestly.
I agree. And the guidance encourages doctors to talk to both men and women
Both men and women.
about the potential effects of WINREVAIR on fertility.
Because it can impact both.
Right.
Absolutely.
Now let's move on to the practical aspects.
Yeah. Of actually taking the medication.
Yeah. How do you actually take it?
It's a subcutaneous injection.
Yeah, it is.
So I'm guessing there are specific instructions on how to administer it correctly?
There are patient education and training are key here.
Patient education is key.
The prescribing information emphasizes the importance of demonstrating to patients or their caregivers
They're caregivers.
the proper technique for preparing
Preparing.
and injecting the medication.
Okay.
It also stresses the need to rotate injection sites to avoid any skin irritation or problems.
To avoid any irritation or problems.
Yeah.
It sounds pretty straightforward.
Pretty straightforward.
But I guess it's always good to have a healthcare professional walk you through it.
Always good to have a professional show you.
Especially when you're dealing with a new medication.
For sure. And what about those times
Yeah.
when life gets in the way
Life gets in the way.
and someone forgets to take their dose?
Oh, right. Yeah, it happens.
That happens. The prescribing information addresses that too.
Oh, good. So there's guidance.
There's guidance.
So what does it say?
It advises that if a dose is missed, it should be taken as soon as possible.
Okay, as soon as possible.
But if it's been more than 3 days since the missed dose,
More than 3 days.
then they should contact their doctor for guidance on how to adjust their schedule.
Okay, so there's a plan.
There's a plan
For everything.
for everything. It sounds like there's a lot to cover,
It is.
but it's all really important information to empower patients to take an active role
An active role.
in managing their PAH.
Knowledge is power.
Knowledge is power.
The more people understand about their condition and their treatment, the better equipped they'll be to advocate for themselves
Yeah.
and make informed decisions.
Make good decisions.
Exactly.
Okay, so we've covered a lot of ground in this deep dive.
Glonogram.
We've explored the science,
All that science.
the potential benefits and risks, and the practical advice for patients. What does this all mean
What does it all mean?
for you, the listener?
For the listener, what's the takeaway message?
If we connect this back to the bigger picture,
The bigger picture.
it means that new possibilities are emerging
New possibilities.
for people living with PAH.
For people living with PAH.
WINREVAIR is a novel treatment with a unique mechanism of action.
A unique mechanism.
And the clinical trial data suggests it can truly make a difference in people's lives.
So there is hope.
There is hope, but as with any medication,
Right.
it's not a decision to be made lightly.
You've got to weigh the potential benefit.
To weigh those benefits
Weigh those benefits.
against the risk.
And that's a conversation
A conversation.
you need to have with your doctor.
Absolutely.
They can help you assess whether WINREVAIR is right for you.
And guide you through the process
You're right.
of starting and managing treatment.
Yeah, it's a lot to consider, especially given the potential impact on fertility.
Yeah, that's a big one.
How will this influence prescribing decisions?
For younger patients,
For younger patients with PAH, it's a complex issue
very complex.
with many factors to weigh.
Lots to consider.
It definitely is, and that's something we encourage you to ponder.
Think about it.
This deep dive has given you a solid foundation of knowledge about WINREVAIR.
We've covered a lot.
But remember, this is just the starting point. We encourage you to continue exploring this topic, stay informed about new developments, and most importantly, have those open and honest conversations
Lots of conversations.
with your healthcare providers
With your providers.
to make the best decisions for your individual needs. Thanks for joining us on this deep dive into WINREVAIR.